morning. Welcome back to Open Med School. Today I am going to discuss with you about mitral valve. In order to understand the pathology that is affecting the mitral valve, we should have a basic understanding of the anatomy of the mitral valve. Main function of mitral valve is to allow forward flow of blood from left atrium into left ventricle and prevent regurgitation of blood back into the left atrium. Let us see what are the components of the mitral valve. Here you can see the mitral valve. It has got 5 elements. First and foremost is the mitral annulus. Then comes the mitral leaflet, the commissures, chordae tendineae and papillary muscle. So these are the 5 elements of the mitral valve. What is mitral annulus? Mitral annulus is the anatomical structure that separates left ventricle from left atrium. It is a fibrous ring that separates. Then comes the mitral leaflets. Mitral leaflets are thin pliable leaflets that contain scallops. That is, which are named from 1 to 3 from lateral to medial. Here you can see that. There are mainly 2 leaflets for the mitral valve, and one is the anterior leaflet, otherwise called AML, which is larger and thicker. It is dome shaped. Here you can see it's dome shaped. Then comes the posterior leaflet, which is thinner and more flexible. And in rheumatic heart disease, this is one which is usually affected. It is crescent shaped. Then comes the commissures. The commissures are the 2 specific sites where the leaflets insert and join into the mitral annulus. The portion, they are the commissures. There is an anterolateral commissure and posteromedial commissure. So that we have studied about the commissures. Now we go into the chordae tendineae. What are chordae tendineae? Chordae tendineae are fibrous strings that attach specific portions of the mitral leaflet with the papillary muscle tips. So tips of the papillary muscle is attached to specific portions of the mitral leaflet. That is the chordae tendineae. The average length of chordae tendineae is around 20 millimeters and their thickness is varying from 1 to 2 millimeters. And in rheumatic heart disease, they may go into thickening, fusion and calcification. It may get rupture. It can occur following myocardial infarction. Then these chordae tendineae are basically divided into primary, secondary and tertiary depending upon the site of attachment. Here you can see the primary, which is attached to the coaptation of the leaflets, that is the area where the mitral leaflets are joining. Secondary is attached to the body of the leaflet. So the tertiary is attached to the base of the leaflets. Now we go into the papillary muscles. Papillary muscles are large trabecular muscle seen from the 1/3 of left ventricle, and they help to connect the chordae to mitral leaflets. Basically, there are 2 papillary muscles, the anterolateral or anterior papillary muscle, posteromedial or posterior papillary muscle. Anterior has dual blood supply, the left anterior descending and circumflex, and posterior has got single blood supply either from the right coronary artery or left circumflex artery. So they are prone for injury from myocardial infarction, especially the posterior one because it has got a single blood supply. So we have studied today the components of the mitral valve or the mitral valve apparatus. Thank you. The next session we will be discussing about various abnormalities of mitral valve, especially mitral stenosis and mitral regurgitation. Hope it was useful to you. Thank you.